In the past, there's just been such bad treatment options for people who lose teeth. I personally love removable things like dentures, but unfortunately, they're not always the greatest fix for people. Long term, I think implants themselves, there's nothing, a dental implant, there's nothing quite like it. It is a tooth replacement. And for the fact that when we lose teeth, you can replace it with a single tooth is such a huge leap forward in the way that we've done things in the past. And I'm excited to offer that from a full service standpoint in my practice, from removing the tooth to placing a bone graft to placing an implant to restoring said implant. I love that I can do everything in my own practice. I never have to refer out. Or if I choose to refer out, it's only for specific cases. But overall, I think that there's just nothing quite like it. It's a long-term, great prosthesis that people can depend on. And truly, I mean, we are replacing teeth. So there's some different components within implants, and it's good for people to understand. The implant is literally the metal screw that is tightened into somebody's bone, and that replaces, you can think of it like the root of the tooth. Once that root of the tooth is, we call it integrated into the bone, meaning it's solid in the bone, we can then put a crown on top of it. Most of the time that is done in a few different ways. It's not important how it's done, but what I can tell you is that is the tooth component that everybody thinks of, and that is called an implant crown. We have some unique abilities within our office to actually deliver that service in the same day. So I can, using the Cerex system, I can scan, design, and deliver that crown in a single appointment, which traditionally we'd have to send out. It would have to be weeks of time in between when the scan was done or the impression was done until we actually fabricated, adjusted and seated the crown. We can do all of that in one day, which is a wonderful service to be able to offer people once that implant is integrated. So it's a neat service because that is quite literally the replacement tooth there that we put on. Because we're replacing teeth, and from missing teeth, sometimes teeth can shift around, bite can change. Through replacing via the implant restoration on the implant itself, we can literally bring that tooth back to life. We put it back in your face, we put it back in your smile. There is no limitation on where it can be done, front, back, bottom, top, that doesn't matter. There are some aspects of it that have to be understood in how you design it, but overall, from a look and function standpoint, there will be no change perceived by the patient between when they had their original tooth and this new implant restoration.